Globally, one of every two men and one of every two women will be diagnosed with cancer in their lifetimes. While cancer incidence rates are still lower in India compared to Western countries, the incidence rates have been fast increasing in the last few decades. Owing to its vast population, the burden from cancer is still huge in a country like ours. More than 1 million cases of cancer are detected in our country every year. Chances are that many still remain undetected. Today, the disease is among the top 3 killers in both rural and urban India. While some kinds of cancers have a genetic predisposition, many avoidable lifestyle-related behaviors are also responsible for the increasing incidence rates. Though tobacco use remains by far the most important preventable cause of cancer, a substantial chunk can also be attributed to dietary causes, infections, alcohol use, lack of physical activity, body composition, and environmental and occupational exposures. Cervical cancer and breast cancer are still the leading cancer sites among the women in India. Genital hygiene, visiting a doctor at the preclinical stages, and HPV vaccination are important preventable steps. Screening tests such as pap smear and acetic acid tests are useful in detecting cervical cancers, while self-examination for any kinds of breast lumps, mammography, and clinical screenings are useful for early detection of breast cancer. In the male Indian population, lung cancer and oral cancer form the majority of cancers, and these can be attributed to chewing betel leaf nut, using smokeless tobacco, cigarette smoking, bidi smoking, and alcohol abuse. Avoiding these substances is the best way to avoid these cancers, while regular screening among users is the best method to early detect these cancers. Remember, prevention and early detection are your two most powerful tools against cancer. Be proactive, especially if you have anybody in your family who has suffered from cancer, and protect yourself.